Hi, my name is Dr. Asta, and in today's anatomy class, we will be learning about deltoid muscle. Deltoid muscle is the bulkiest muscle present in the shoulder joint. It covers a lot of structures under it like nerves, arteries, a lot of muscles, tendons and shoulder joint. It's also clinically important because the intramuscular injection is given in the bulk of deltoid. The deltoid muscle has altogether 3 fibers: anterior fiber, middle fiber and posterior fiber. Now let's see where these fibers come from. The anterior fiber of deltoid originates from the clavicle, from the lateral aspect of the clavicle. Since this is the medial part of the clavicle and this is the lateral part of the clavicle, so it comes from the anterior border of the lateral end of clavicle. So this is our anterior fiber. Now the middle fiber comes from the acromion process of scapula. This is the scapula. This one is the spine of the scapula, which continues as acromion process of scapula. So the middle fiber originates from the lateral border of the acromion process of the scapula. This forms our middle fiber. Now coming to the posterior fiber. Posterior fiber arises from the spine of the scapula, as scapula is present posteriorly and the spinous process of the scapula also lies posterior to our body, or the posterior to the scapula. So the posterior fibers of deltoid originates from this lower lip of the spinous process. Okay, so all these 3 fibers together form a huge bulk and come down together to get inserted in the deltoid tuberosity, which is present in the humerus. So the humerus, in the shaft of the humerus, we have a deltoid tuberosity which is present in the lateral part, which is just right below the greater tubercle, and in that deltoid tuberosity, the name itself, it suggests the entire bulk of anterior, middle and posterior fiber, which is coming from the clavicle and scapula, gets inserted in the deltoid tuberosity of humerus. Now let's see the course of the muscle. In our body, this is the clavicle, right? So in clavicle, this is the medial end of the clavicle and this is the lateral end of the clavicle. So the anterior fiber of deltoid originates from the lateral end of the clavicle, which is anteriorly present. That's why it is also called as the anterior fiber of deltoid. Now, why is it called the middle fiber? Because it is present in the center of the other 2 fibers. So the middle fiber originates from acromion process of scapula, which is present here. So the fiber which is coming from this, so this bulk of deltoid is our middle fiber of deltoid. Now coming to the posterior part. Posterior fiber of deltoid, as we already discussed, it originates from the spinous process. Now where is the spinous process? It is present posteriorly in the scapula. So from here, the posterior fiber of deltoid comes this way. This posterior fiber, this middle fiber and this anterior fiber together forms the bulk of deltoid and down together and gets inserted in the deltoid tuberosity of humerus, which is present here laterally. So this is the origin and insertion of deltoid muscle. So now let's come to the action of the deltoid muscle. Deltoid muscle, as it has 3 different fibers which are directed in different ways, the action also varies. When the muscle contracts or it shortens from insertion to origin. If this is the origin and if this is the insertion of the muscle, it shortens in this way from insertion to origin. And while doing this, it pulls the bone where it is attached, the insertion bone, towards the direction of the pull. So here in the anterior fiber, let's see, it comes from the clavicle, lateral end of the clavicle, and inserts down in the lateral border or the lateral aspect where the deltoid tuberosity is present. So it inserts there. Now when the muscle contracts, it shortens from insertion to origin. So while doing that, it pulls the humerus upwards anteriorly, and this movement is called as flexion of shoulder joint. And along with that, because the muscle is directed from medial to lateral, when it shortens, it also causes medial rotation of the humerus. Therefore, the anterior fiber of deltoid, which is coming from the clavicle to humerus, when it contracts or when it shortens, it pulls the humerus anteriorly because the muscle is passing anterior in the shoulder joint. The middle fiber of deltoid originates from acromion process and inserts to the deltoid tuberosity. So it is present on the lateral aspect of our shoulder. When this muscle shortens, it elevates the humerus in this direction, that is, it elevates the humerus laterally, and this movement is called as abduction of shoulder joint. Therefore, the middle fiber of deltoid is responsible for causing abduction of shoulder joint. Now coming to the posterior fiber of deltoid. Posterior fiber is present posteriorly, coming from the spinous process. So this fiber, when it contracts, it pulls the humerus posteriorly. It causes posterior elevation of the humerus, which is nothing but extension of shoulder joint. It also pulls the humeral head laterally, cause lateral rotation of the shoulder joint. Hence, the posterior fiber of deltoid causes extension of shoulder joint and lateral rotation of shoulder joint. Let's summarize the whole action part. The anterior fiber of deltoid is responsible for flexion and internal rotation. The middle fiber is responsible for abduction of shoulder joint, and the posterior fibers are responsible for lateral rotation and extension of the shoulder joint. The nerve supply to deltoid is provided by axillary nerve, which is a branch of posterior cord of brachial plexus. I hope that this video will turn out to be very useful for you. Don't forget to subscribe my channel and like my video. Thank you and bye-bye.